So welcome everyone. Let me introduce myself and my PhD work. So the topic of my PhD will be the role of gut microbiota in cystic fibrosis. My name is Blanka Bódy. My supervisors are Andrea Párniczky and Klementina Ocskai. My scientific methodological supervisor is Dorottya Gergő. My vision is to offer a complication-free life for people with cystic fibrosis. My mission is investigating the role of gut microbiota in the disease. So here you can see my project list. I will aim to compare the connection between cystic fibrosis and dysbiosis in both of my projects. So let's talk about my first project. It is the comparison of gut microbiota in cystic fibrosis patients and healthy individuals. So a few words about the background. Between 70,000 and 160,000 people are living with cystic fibrosis worldwide. That is 1 in every 4,000 live births in the European decent population. Here you can see the gut wall of a cystic fibrosis patient and a healthy individual. So in a healthy individual, the CFTR channel works just fine. They have a balanced gut and a normal intestinal flora. However, in a cystic fibrosis patient, the CFTR channel is dysfunctional, and it results in several local and systemic complications, including a continuous inflammatory cycle. So our aim is to compare the gut microbiota in cystic fibrosis patients and in healthy individuals. Our clinical question is, how does gut microbiota differ in cystic fibrosis patients and healthy individuals? Our population is adults and children. The exposure is cystic fibrosis, and the comparators are healthy controls. So our outcomes are alpha diversity, beta diversity, and the abundance of certain bacterial species. Our hypothesis is that cystic fibrosis patients have a less diverse gut microbiota compared to healthy controls. Our implications for the clinical field is targeted personalized interventions, for the policymakers' recommendations on dysbiosis management, and for the research field, therapeutic microbiota modulation. We conducted our systematic search in 5 databases on the 13th of November. You can also see our search key here. It consists of 2 main domains. So let me present to you 3 of my key articles. The first key article has more than 50 patients in it and reports all of our outcomes, but it has an overlapping population with another article that we have found, and it also only reports the results on diagrams. The second key article has also more than 50 patients in it and reports all of our outcomes. And we have the abundance data in numerical format, but it also has an overlapping population with another article. The third key article, however, has more than 200 participants, no overlapping population, and reports all of our outcomes that we are interested in. The only little flaw that it has, that the outcome data is only shown on diagrams. So let me present to you where we are at with the selection process. Firstly, we had more than 2,000 hits. Then after the duplicate removal, we had 1,900 articles. And now we included 62 articles into the full text selection. And finally, we have 17 full texts eligible. As you could see, we are now at the data extraction phase. We are halfway through with it. So my second project is the investigation of gut dysbiosis in cystic fibrosis patients according to different glucose tolerance statuses. So cystic fibrosis-related abnormal glucose tolerance is a very common extrapulmonary manifestation. It is present in every 3rd child. So first, we have the dysfunctional CFTR protein, which results in various consequences. For example, pancreatic fibrosis, continuous infections, the presence of autoantibodies, and dysbiosis as well. So dysbiosis, as we know, is closely linked to the buildup of inflammation, which plays a key role in the onset of cystic fibrosis-related diabetes. Let's take a quick look at how dysbiosis is linked to type 1 and type 2 diabetes in non-cystic fibrosis patients. So it is thought to have a connection with type 1 diabetes through signaling pathways and the leaky gut, and to type 2 diabetes through various metabolic pathways. So our aim is to investigate the association of gut microbiota changes in different glucose tolerance statuses. The source of our data will come from the cystic fibrosis-related pancreatic disorder registry at Translational Pediatric Institute. The registry was established in 2018. It has 101 patients in it. They have regular follow-ups every year, and stool samples are also collected. Our inclusion criteria will be children under 18 years of age with cystic fibrosis diagnosed. They have to have the result of an oral glucose tolerance test available and a stool sample as well. Exclusion criteria will be no informed consent and missing data. So our clinical question is, what are the main differences in gut microbiota in children with cystic fibrosis-related abnormal glucose tolerance compared to children with normal glucose tolerance? Our population is children with cystic fibrosis. Our exposure is abnormal glucose tolerance. The comparator is normal glucose tolerance. And the outcomes are alpha, beta diversity, and the abundance of certain bacterial species. Our hypothesis is that dysbiosis is associated with cystic fibrosis-related abnormal glucose tolerance. The implication for the clinical field is screening and treatment of dysbiosis in cystic fibrosis-related abnormal glucose tolerance, for the policymakers' recommendations on dysbiosis management, and for the research field, microbiota correction in cystic fibrosis-related diabetes. So in summary, I will aim to find a link between dysbiosis and cystic fibrosis in both of my projects with the help of different scientific methodologies. So my chosen quote is, "The man who moves a mountain begins by carrying away small stones." Thank you for your attention.
Thank you very much and congratulations. May I ask you that do you plan a subgroup analysis, because it's really important here, because for instance a patient with cystic fibrosis who also has a liver disorder, for instance, that itself can influence the composition of the microflora. And if may I suggest you something, it would be interesting to find such parents or children who are related to this index patient who are heterozygotes, because it would be highly interesting how the microflora is changed in this patient, because maybe the composition could be in between, because the CFTR gene is a bit wrong even in the heterozygote. For instance, that was the reason that this gene survived, because it was good for preventing the cholera.
Yes, so thank you for your question. We plan to do a subgroup analysis in both of our projects. So in the first project, we will shortly do a subgroup analysis based on age. So we will look at how microbiota composition is in infants, so up until 1 year of age. Then we will look at what it looks like in children up until 21 years of age. And we also plan to look at, of course, adults, so above 18 years of age. If we get enough data, we want to conduct a subgroup analysis based on pancreatic status, which is also a very interesting aspect. As for the second project, we also plan on investigating the composition of gut microbiota regarding the age groups. Also, as I've mentioned, regarding the different glucose tolerance statuses. So yes, that's about it. And about your comment, comparing children with cystic fibrosis and relatives, we have found articles about this relation. So they have investigated what it looks like, so what the differences are between a healthy sibling and a cystic fibrosis patient. And they found that the cystic fibrosis, that the healthy siblings had normal gut microbiota, so their microbiota did not differ from the average population.
Okay, thank you very much. Any more question from the audience?
Yes, here, please.
Yes.
So first of all, congrats on your excellent presentation.
Thank you.
I would like to ask about, I think, both projects.
Okay.
So I have two questions, actually, very short questions. First one is, do you have any specific bacteria that you could see maybe in the studies that you think is the most dominant in the case of cystic fibrosis? And second one, if you saw any outcome measure of relative abundance in your studies, because I know from my experience that it's really hard to work with it. So yes or no, it's enough.
Okay, so please save your second question, because my memory is like a goldfish when it comes to discussion. So about the first question, there are certain species that are related to cystic fibrosis gut microbiota. For example, Veillonella, Enterococcus, there's also Streptococcus, Staphylococcus. These species are strongly related with the cystic fibrosis gut environment. Their abundance is increased. As for the beneficial species, there are certain ones that have a decreased abundance. For instance, Faecalibacterium, Rosaburia, Lactobacillus, they are all short-chain fatty acid producing bacteria, which are really beneficial for us, and their abundance is decreased in cystic fibrosis patients.